Yes, ma'am.
All right. So, hi, welcome everybody. I'm Lydia Giordano. I'm going to be your moderator today for the panel. This is our Minority Mental Health Webinar Plan of Action quick webinar. And we have some great panelists, but first, who am I? I am a partner in MYS Counseling. We have locations in Lake Jackson and in Manville. I'm also the COO of MYS Initiatives, which educates counselors and on how to do neurobehavioral counseling. And I'm on the board of MYS Education, which provides services throughout, throughout the country in workshops and individual counseling for veterans and other groups. On our board today, we are very happy to have Brooke Peterson. She's a recovery specialist and she's a member of the LGBTQ community. Brooke, give us a wave. There we go.
Everybody.
We have Jonathan Griffin. Excuse me. He's a business director. Jonathan's a business director at West Park Springs Hospital. Everybody wave, Jonathan.
Hello. Hello, everybody.
And we have Gil Romero. He's on the NAMI Gulf Coast Board of Directors. He does local digital and TV marketing, and he is a consultant for Univision Communications. Hi, Gil. I want to thank everybody for being here today. Today is all about awareness and finding that commonality in various groups, whether it's an ethnic, religious, racial, or other kinds of diverse groups. Understanding that we all face similar challenges, even male to female, trans, LGBTQ, whatever group we're in, we have common themes going on, don't we? And we're going to talk about that today. We'll talk about some kinds of issues that we're having, how you feel mental health represents you or serves your needs, and how it doesn't. We want to make you aware of services that we have for you guys, services that are available in the area to meet your needs. And if you have any questions or comments, we really would like to hear from you. And that's the reason we're putting this webinar on open to the public. So one thing that I want to ask you guys, the panelists, is do you find that there's a common theme among your minority population when it comes to accessing mental health services? And Brooke, you're unmuted. I'll let you go first.
Okay. Thanks, Dia. So I would say yes, to answer that question. For many LGBTQ people, socioeconomic and cultural conditions negatively impact mental health conditions and the ability to access mental health services. Many in the LGBTQ community face barriers such as discrimination, prejudice, denial of civil and human rights, harassment, violence, and then family rejection is a big one, which can lead to new or worsened symptoms. So yes, I absolutely think that that is an issue in the LGBTQ community.
Okay. What about you, Jonathan?
Oh, absolutely. And I want to start with, just the lack of resources to the community. And then the knowledge of knowing that there are resources that are available. So I am so gracious to this panel because what we're doing now is creating a piece of vehicle for awareness. And I think that's the absolute missing piece in the African-American community is awareness and knowing that there are resources.
Mm-hmm. Okay, and Gil?
Well, with Hispanics, two of the big factors that really hit there are language and then socioeconomic status. Language, a lot of the materials they may not know are aware of Spanish, and a good part of the population, especially in the Houston area, is still continuing to grow primarily from, Hispanic first generation that are moving into the area. So that's a big factor. Not access to insurance. There's a good portion of the Hispanic population that doesn't have medical insurance, and that leads them to not seek out for help, or to not at least make the attempt to try to find out if help is available, given the fact that they don't have insurance.
Mhm. Yeah, so just in general, between the three of you, accessing services, availability of services, and then having that sensitivity to particular needs. And that's one thing I wanted to ask you about next is, how did you find, let's start with you, Gil, when you were growing up, or if you knew anybody that accessed mental health services in your culture, what kind of difficulty did you find, or what was your experience?
We didn't know that that's what it was. We had names for it, we had cultural colloquialisms as to how to group them or what they fell under, but we didn't know that it was specifically mental illness. And a lot of the mental health issues and the categorizations of different kinds that are out there that are out there now weren't really being talked about. When I was growing up, I grew up mainly in the 70s and 80s. That was my childhood and adolescence. There was also a cultural resistance, simply because there's a pride that comes with the Hispanic culture of they're wanting to be anything wrong, and if there was, you didn't talk about it, and you didn't air your laundry out in public.
Just fix your problem and go on. That's right.
It was a private thing. See, and
right.
A unique thing that I talk about through my testimony with NAMI Gulf Coast is that I come from a family where my mother was a registered nurse. So she was very by the book on everything. And I have the liberty of continuing to, growing up, I'm the oldest male, so that's something within the Hispanic family as well. I didn't get as not coddled, but as guarded and watched over, as my younger sisters did. So when I started having kids, and I was away from South Texas, I was away from home. I had the liberty of kind of taking the first step on my own as far as how I was bringing them up. Sisters didn't. My mom was very, not overbearing, but she guided them strictly the way she knew how. And my baby sister's oldest son has been diagnosed with a borderline Asperger's and symptoms of that. And when my baby sister was trying to get help for him when he was young, my mom resisted it big time, and really was coming up with all these reasons that she was doing wrong as a parent as to why he was that way.
Yeah. That's a very, I won't say that that's necessarily common to all cultures, but there are quite a few cultures, particularly Hispanic and Asian cultures. And when I say Asian, I mean also Arab cultures that are very resistant to either opening up, admitting there's a problem, or airing their dirty laundry, even though it's to a confidential therapist, right?
Yeah, and just to close it out so I don't take too much more time, there came a point in time when I shared with her what we were going through with our kids as well. I've got adult ADD, and I started sharing some of that with her for the first time. And it caused her to take a step back and say, just look at me. And I for the first time and a few times in my life, saw my mother vulnerable in the conversation. And she looked at me and she says, son, well, what is all this? I don't understand it. I don't know what all this is. And that opened me up to tell her, you know what, Mom, a lot of what this is stuff that we're finding out for the first time, and that we're now seeing that there's things that can be done about it in order to make life better.
That's a really, really good point, Gil, that, a lot of times for these cultures, it's never been presented to them that it doesn't mean there's something wrong with you. And I think, Brooke, I know that you guys, you'll identify with that. There's not something wrong with them. It's not something wrong with me if I have depression. It's something that I'm dealing with. It's something wrong with me if I'm LGBTQ. This is my wiring. This is how I am. This is what I choose. And so presenting that side of it through a professional counselor or through services, is validating, right? It helps even families to understand, oh, I didn't fail as a parent. That's a huge thing to
Absolutely.
understand that. And I think more of the public is coming to understand that mental health is a priority, and any issues with mental health doesn't mean that the person is defective.
Absolutely. I'd like to piggyback on that as well. Gil, I'm glad you brought the fact of Asperger's up. I too have a son who has Asperger's, and a lot of time that can be mistaken as just bad behavior. So, overall, our mental health conditions in our Black community are about the same, or, less frequent than white Americans or any other race for that matter. But being an African American man, the experience, in America, continues to, it characterizes us by the trauma and violence that Black men have gone through a lot of times. So it impacts the emotional and the mental health of both youth and adults when, you're not only dealing with something perhaps as Asperger's or some other type of, situation, but also being a Black man dealing with that. And it's, we've seen great strides, but I still think there's a lot of work to do. But my thing is with mental health, I am so appreciative of Sergeant Vandergriff and our crisis intervention teams who are now making, our sheriff's departments, our police departments more aware of, conditioning to recognize mental health and say this is a situation for a crisis intervention team.
Absolutely. Kudos to that behavioral health team.
Right. Absolutely.
That's great. And Brooke, tell me how it was for you or your experience as you got older and you accessed mental health. I know we talked a little bit the other day, but if you would share a little bit of that, I'd appreciate that. I think that listeners would like that.
Sure. So first I want to say, just to kind of put some data out there. So per the NAMI website, there is strong evidence from research. The members of the LGBTQ community are at a higher risk for experiencing mental health conditions, especially depression and anxiety disorders. What that looks like, LGBTQ adult and youth are more than twice as likely to experience mental health conditions. And then transgender individuals are nearly 4 times as likely to encounter feelings of sadness, hopelessness than their cisgender peers. And cisgender is somebody whose gender identity corresponds with their birth sex. So I had to explain that to my mom. So
we all need that class.
Yeah, we've got a lot of terminology going on. So, I'm also grateful to, educate people about that. And just kind of, just quickly here. So the LGBTQIA plus. So there's a longer version, but basically what that stands for is lesbian, gay, bisexual, transgender, queer or questioning, intersex, and asexual. So just to throw that out there, I know it's a lot to keep track of. So yes, so Dia, from what you mentioned, so my personal experience growing up, I feel like I was socialized into thinking that being anything other than heterosexual was somehow bad or wrong, immoral. And what that did for me, is that led to feelings of self-disgust, self-hatred, and what we call internalized homophobia.
Mm-hmm.
And that, I came from a very religious background, very, very strict religion. And their view was that initially their view was that this was being gay was not real, I guess, and so I did experience some therapy, to kind of turn me the other way. But, as far as growing up in a religion like that, it wasn't talked about. I did not start talking about my sexual orientation until my mom confronted me my first year of college. And I was at a very religious private university, so that was not easy. And so I would say, you know, and kind of as the two gentlemen mentioned, as we go, you know, I feel like these days the LGBTQ community is getting more exposure than ever, and more understanding and more acceptance. You know, we all have a long way to go, but I'm grateful for where we are at. You know, mental health wise, I come up from a family that has dealt with, on my mom's side, depression. And so that was something, you know, when she had me, it wasn't talked about. She wasn't medicated. She experienced postpartum depression, and she was kind of expected to suck it up and, you know, just kind of deal with it. And so as time went on, I feel like, you know, when I was a teenager, I was able to get on medication to help with the depression. And, you know, it's like I said, we're headed in the right direction. Absolutely.
And so you experienced some discrimination or bias and even unethical counseling from some counselors initially, right? And
right.
then you were
Yeah.
able to find someone else.
So I did. So I was sent to religious therapists to kind of, you know, in line of my parents thinking, okay, well, this is what we believe, so we want you to go to this therapist so they can help you
Figure out that you're wrong.
I mean, you know, and so what that did, unfortunately, is that was harmful for me.
Yeah.
For you know, many reasons.
Of course.
And when I was in school, when I was in college, I was sent to do conversion therapy. And that, you know, if you know anything about that, I consider myself lucky compared to a lot of people. But, you know, it was rough. You know, I was given assignments to try to turn me straight. And so for a good part of my life, I thought that who I am is wrong, and I was trying to fix it. To answer your question. Now, to say that, I have seen so many good therapists, you know, and people like Dia and her practice are phenomenal because they are aware of these issues and they meet you where you're at. And I feel like they provide a lot of safety. We discussed that word the other day too. So, yeah.
Thank you for sharing that. All three of you, thank you for sharing that. Now, one thing I want to ask is that just as a counselor, when we're educated, before we become licensed, we take cultural competency, we take, you know, this gender awareness classes, things like that, and clinics to try to make sure that we are not acting out of bias. Now, we all have bias. Bias is not prejudice, but it is a belief tendency. And we have to overcome it, right? That's ethically how counselors are supposed to be acting. And if a counselor, let me just say this, is not acting ethically, if they are treating a client through their own bias and they have not made it clear beforehand that they're this certain kind of counselor and they work with this bias, then they should be reported to the State Board of Licensing in Austin. And it's very easy to do. You just Google online, report Texas therapist, and you'll find the link to do that. So this is a discussion that therapists have, and we in fact had it in our group, one of our mentoring groups last night with our therapists. Are you making sure to rein in your bias? And how do you know? And so we have those concerns about ourselves. We want to be the best we can be for you guys, whether it's Muslim, whether it's gay, whether it's African-American, you know, Pakistani, Filipino. It's important that the therapist be able to overcome their own history and self, because our goal is to treat you as the human being that you are and help guide you to wellness, right? And that doesn't have to do with the way we grew up. It has to do with how you grew up and how you and the experiences you've had, right?
Right. And Dia, I know you mentioned wanting to know when we spoke the other day, questions, about what should our communities, what should these people ask clinicians to find the appropriate therapist, right?
Absolutely.
And I want to share a link because I don't want to hijack it. Excuse me, but I do want to share a link that's good information about what clinicians should ask a potential LGBTQ client from goodtherapy.org. So I'm going to see if Mariah will send that out. But yeah, that's definitely a good thing to bring up.
Thank you for that. Thank
Absolutely.
you. And one really quick thing, and I don't want to make this painful at all for any of you, but what are some things that therapists have done perhaps to you in the past or said that have made your ears kind of prick up and think that's offensive?
Well, asking, open-ended questions. And of course, I've not been to therapy. I've sat in on therapists and some with patients just to add support. There are some right and wrong ways to ask questions and a lot of open-ended questions because, an open-ended question won't get you what you're looking for most times or not especially in a mental health situation. So I think really knowing who you're dealing with and getting the most out of those notes, which is imperative to me. And that's what I really look for when I'm looking to provide assistance and preserving that next day. I want to grab and capture as much information about the patient, bring in family members. And I think you get more of the meat and potatoes of the core of what's happening mental health wise when you add in those pieces. So that's the most imperative thing to me. I always invite, those family members in, and I need information from all doctors and all counselors. I need as much information as I can get, and then avoid that. I really think, but I've worked with a lot of awesome therapists. So different ways for different people.
Right. Well, I think one important skill for therapists, and it's my policy and how I teach my supervisees, that we do not minimize.
Right.
If it's true for the client, then we need to act like it's true in this room.
That's right.
And we may not be able to identify with fear of a policeman stopping us on the road. We may not identify with that.
Absolutely.
But other people do. And that fear there is no difference between what we consider valid or not valid. It has to do with the client's emotional reaction.
Absolutely.
And the acknowledgement and validation that I see that you're feeling that. I appreciate that you're sharing that.
Absolutely.
What about you, Gil? Are there any kind of terms or words that need to be avoided as far as language? We hear, in therapy and in society, honestly, we hear so many terms. And like Brooke was saying, when I met Brooke the other day, I used the term LGBTQ, and I wondered if she would correct me and say I need to say the IA.
No.
No,
you're good, Dia.
There are,
I realize that it's the same subject of getting beyond the fear that you feel initially when approaching something that's uncomfortable. I felt it right now, and you asking the question for both the question that you asked prior and then this one that you're asking now. Real quick, in the prior, gratefully we never had a bad experience when it came to therapists, and we moved beyond fear of just placing our son, in this case, in front of a therapist in order to try to help get an answer for what was wrong with him. And when you know that the therapist is on the right track, you feel it. Because our son was going through a period where it was dark. He was having a lot of anxiety. He would walk around with his hoodie, and we would only see the top of his head in the hoodie. He would never look up. And when the therapist was talking to him and we were in the room, as the therapist was approaching him in conversation, we just saw our son's face light up, because the therapist was asking every right question and was understanding what he was going through. Right. And I hadn't been able to get there yet in order to be able to really get across what was going on. Had we had a fear of taking him in the first place, that never would have happened. And when it comes to Hispanics in this case, first thing that comes to mind is, Hispanic is a very umbrella term.
I was just thinking that.
I laugh. Comedian George Lopez always says, who invented the term Hispanic? I've never heard of the country of Hispania. There's no Hispania out there. You're
Right.
from a place, specifically. And under the Hispanic umbrella, there are so many regions, so many areas, so many different dialects within the Hispanic umbrella.
Mhm.
It starts with being open to receiving and answering the questions, of how to best approach them with regards to what their ethnicity is, what region they're from, and really what they're used to in their dynamic, in order to
Right.
start earning that trust and get that conversation going and continuing.
And tell me if I'm wrong, of course, that's why we're here. I want you to, give me your feedback. But to me, I think that when you have a Hispanic client, whether you're Hispanic or not, as a counselor, whatever your race is, to ask them what is your heritage? Maybe they're born here, maybe they're born in Mexico, Guatemala, South America. What is your heritage? And then what is life like there? What is life like there?
Those are awesome questions, because that immediately, you ask someone where they're from, and if they're Hispanic, it instills a pride in them. They
Mhm.
wrap up a little bit.
I think it helps them feel seen.
Very much. And they like to talk about where they're from and
Mhm.
their experiences are. That helps bridge that trust factor that we
And
talked about.
asking the question, how do people see mental health in that country or in that culture?
Yeah,
is a good
absolutely.
question, because it I think the answer will tell you where the client's at and what they're
Mhm.
expecting to hear, maybe, and
Right.
how we can counter that with positivity and acceptance.
Right. And I would add two other, along with, their culture, how their culture sees mental health, how their family sees mental health.
That's a great question.
Because, a lot of it all goes up, it all goes to the upbringing, to
Mhm.
their own personal experience and how they were raised.
Yeah, that's great. So I know, Brooke, you said that you've experienced discrimination based on your background. What about Jonathan or Gil? Have you experienced anything with mental health services, even if it wasn't therapy, or trying to get mental health services in the past?
Well, I started in my mental health journey back in Northwest Arkansas in 1992. I was a psychiatric technician. And, for some reason, I knew that, we had a decent Black population there. But, you never saw a lot of the African Americans involved at the hospital that I was involved in at that time. So, it also caused me to wonder. I said, wow, do we understand mental health? Do we actually know what it is? Or do we as a culture just see it as bad behavior and we treat it as such? So yeah, my awareness became very prevalent back in the early 90s as to that. Now, whether it was a situation where we just, the hospital said, hey, we're just not accepting, or is it a situation where they're not coming? You never know. But you see the disparage in the numbers of people that are getting treatment in those hospitals. At least I did in 92. And I had that in the back of my head that, maybe that this is not a welcoming area or a welcoming arena for the African-American society, because they don't see them as, hey, you don't have an issue. You need to be here and lock you up. And that's where our issue is. So you could say that, maybe there's a disparity in that, but you just never know. And I think, too, with the awareness and education, it comes, better outcomes.
I agree. Well, and so as far as accessing services, for example, I'm going to thank Gil particularly about Spanish-speaking therapists who are competent therapists and available depending on, socioeconomic background or whether they have insurance or not. Is that an issue in Brazoria County in particular.
I mean, it very much can be, you know, and what's sad to think of also is that there may be people that prey on you know, people's inability to communicate effectively in language, and also what their beliefs are and what they're used to. Yeah, it begins with trying to educate and aware, just as Jonathan just mentioned. You know, education and awareness is key. And one of the things that I'm starting to tap into also is who is sending that message is important as well. Because there are members within the community or organizations that are revered more highly or just looked up to more. And hearing the messages from them can very much help people to be more open to, you know, approaching and seeking, you know, advice.
Absolutely, absolutely. And as we have those public figures come out, and even just this week with Simone Biles coming forward and talking about mental health issues, and she's more than her accomplishments. And I thought that was just a beautiful, beautiful message, that her whole life is important, not just this one day. Right. And I think that's helpful.
With one thing that I can honestly say within the Hispanic community is that one thing I think that we need more of. We're starting to, you know, gratefully, this pandemic has really shone a light on mental health, you know, unlike any time before in our lifetime, I think
you're right.
And it was very good to see that, you know, back in May 20th to be precise, Univision nationally was part of a mental health action day.
Oh.
Where they partnered with MTV and 200 other huge corporations, you know, and trying to empower the community to take action towards bettering their mental health. And that was unprecedented. Nothing like that had ever happened before. And
I didn't know that. That's excellent.
Yeah, there's a website, you know, the website's still up. It's mentalhealthactionday.org. And, you know, it can be seen in English, and you can toggle it to where it can be seen in Spanish as well. But those are the initial pebbles in the pond that get people talking and start to create that awareness. You know, I'd like to see more celebrities coming, you know, forward with their stories, you know, and more local celebrities too.
You
know,
absolutely.
In the case of Univision, I reached out to community, to our director of community empowerment, to let her know that I was going to be a part of the panel, and asked her, you know, what we were doing, you know, what are we doing right now? And I found out that during May Mental Health Month, we also supported the national activity with local news programs, news stories, and a news show that they did also. So my next step is to ask her to get the local DJs involved as well, and the local.
Oh wow, that's great.
And the local TV talent. If you know, if we can, you know, personalize it at a local level, that can have a lot of community impact as well.
Absolutely. No, I think that's great. The radio is a great vehicle. And I think also, you know, one thing that is my goal to do for our clinic website anyway, and then we're trying to translate our book into Spanish also, but to translate them into Spanish, to have the option that the website is in Spanish or English, just because those are the two most prevalent languages. I know in, you know, Fort Bend County has got, I can't even tell you how many ethnicities and cultures. It's a wide variety, but even in Brazoria County, we have quite a wide variety of ethnicities. And I know at the clinic, we have, I can't even count all the cultures that are coming in: African, Asians, Arab, and of course, all kinds of Latin American cultures, European cultures. We've got everything in Brazoria.
And that's something that we're definitely going to continue to see more of, and that we need to be, you know, just accepting of. Houston,
absolutely.
Houston's the most diverse city in the country. And Houston is continuing to spill over. You know, I live in Pearland, so, you know, now that they've finished up the 288 expansion, you know, just literally begin to see every month something new popping up, you know, going further.
Yeah, absolutely.
People are going to continue to move outward, so there's going to be a lot of diversity that, is going to be coming to areas like Brazoria County that they hadn't encountered before. So,
That's absolutely true.
Right.
Well, thank you, Gil. And I was going to ask you too, Brooke, the same thing. What kinds of things can clinicians ask to make the LGBTQ community feel safe, feel welcome, and also able to, because a lot of times we're working on identity, we're working on self-esteem, we're working on the big picture, even before we're working on the LGBTQ, issue, right? What would be your recommendation?
Well, that's a good question, Dia. And I would like to bring up the fact that, there are not enough mental health resources for transgender people. And that is something that is huge. And I noticed in the comments that Crystal Williams shared that UTMB offers an LGBTQIA+ clinic, and it's transgender care. And I think that's amazing, because with the pandemic in 2020, I want to shine a light on the fact that violence against transgender people, especially Black transgender women, was one of the deadliest epidemics in the US in 2020. And that's something that not a lot of people know. And a lot of it happened, good part in Houston. And so I think being sensitive to that, especially our transgender population, as you talk to people that, could be a potential client. And I would say, so with this good therapy link, really what it is, let's see, I want to kind of list what I want to do, and this can kind of go both ways. So as far as what questions should a therapist ask an LGBTQ person to see if they're a good match, what questions should the potential client, and this can go both ways. So how do you view gay, lesbian, bisexual, queer, transgender individuals and their relationships, right? And that's something that I think a therapist can also offer as well. Meet them where they're at, right? And it's like Dia said, how you feel and who you are in this room is 100% correct, 100% right, and 100% okay. It's that validation, right? Because I know for me, for years going and seeking therapy to turn me straight, I felt that I felt like I was broken, and I felt like I needed to be fixed. And unfortunately, my surroundings kind of supported that at the time. And so I think, like Dia said, reassuring people there is nothing wrong with this. There's nothing wrong with who you are and where you're at. And I do believe that, LGBTQ relationships are as valid as heterosexual relationships. I think it's also important to talk to somebody about how much about the LGBTQ population, as far as kind of what kind of training, and do you have enough training? And if you don't, seek out that training so that you know the lingo, so that you know where somebody you can really relate with where they're at. And then, I think for a client to come in and say, how do you work with clients presenting problems or issues similar to mine? What's your treatment approach? That can go for the therapist too, right? That's something that you can offer, because sometimes clients will come in, and say, I don't know what to say. I don't know what to ask. I'm afraid. And then I think that's when the therapist can step in, or the clinician can step in and say, hey, you're safe. This is okay. Anything that you share, you're safe. And so those are just kind of some ideas. Like I said, that Good Therapy website, I suggest everybody take a look at it, all clinicians, just to get familiar with that.
That's great. And so, choosing a clinician for whether it's gender-based or sexuality-based, whether it's culture, ethnicity, religion. The reason people want to go to a counselor is to get help where they are and feel safe doing it.
Right.
And so asking those questions to your therapist is totally acceptable. And if you don't click with that therapist, they do not take it personally when you want to switch. And we tell our people up front, if you try a couple of times and you don't click with this therapist, please let us know. We want you to get the help you need. We'll put you with someone else that might click better after having a discussion. And so I really want the public to know that that is true for all clinics, all therapists. We know we have to have a fit because trust is involved, right? We want you guys to feel safe and trust so you can make the progress that you want to make. That's great. Thank you. So really, another question I had for you guys is, what is it that personally drives your passion to advocate on behalf of your segment of the community? And you can go ahead and start, Brooke, if you want to, since you're already up.
Sure. So I would say my personal experiences, like as I mentioned, with being socialized into thinking that, like I said, being anything other than heterosexual was somehow bad or wrong or immoral. That caused me, I'm a person in long-term recovery, and those feelings led to alcohol and substance use for me. That's how I coped. That's how I checked out. And so, and ultimately I survived a suicide attempt, and it was a struggle to get to where I am now. And so I would say, I know without a doubt in my mind that I'm still here on this earth to help others that are going through or have gone through the things that I experienced. I want to walk with others down that path and show them that there is hope. Hope is huge. There is hope.
So what is a recovery specialist? What is
so
that?
a recovery specialist, so that can be mental health, peer support. A recovery specialist is somebody that is kind of like a recovery coach. A peer specialist, somebody that walks through the process with somebody to show them, hey, you can recover. Look what I did. You can do it too. Right. And so that's something that, and to show people, you're not a mistake, and help people to learn to love themselves.
So you're helping them recover from being from the abuse or from substance abuse or all of that.
Absolutely. Or find resources for mental health. Yeah. So I would say that's what drives me.
Okay. Thank you. And Jonathan, what about you?
Well, I definitely have a passion for mental health. Again, I have a son who has Asperger's, and once we got into what was really going on with him, my passion to drive and to make him a viable person in this community, although he still has his issues going on. That drove my passion 19 years ago. My son graduated high school. He's getting ready to take classes. So seeing that and it come full circle for me, my first real job again was a psych tech at a behavioral hospital, my very first job. And now I'm full circle and I'm back into mental health. So passion, helping others, my son, and then helping those people to preserve that next day, and to see them walk out of our hospital at West Park Springs with their heads up saying, hey, I feel good today. I'm going to make it through this day. It makes me feel good. No matter how long it took or how short of a time they were with us, it feels good to see them walk out those doors.
Mm-hmm.
I may be back, but hopefully I won't. And again, creating those partnerships with hospitals and meeting people. I'm in business development, people, so I'm not a therapist, I'm not a doctor, but I've been around in the mental health arena for a long time. So being able to create those relationships with doctors and people like Brooke and Gil and yourself, again, Ms. Jan, who brought me on board with NAMI in this conversation, and Sergeant Vandergrift, just creating those partnerships with those types of people You know, it makes it really, really awesome to wake up every day and say, who can I help today? And whose life can we preserve for one more day? And to make sure that everything is, you know, just a-okay when they go to sleep. So
That's great.
that's
Thank
where
you.
my passion is.
That's it. That's great. Thank you. And Gil, I know you're with NAMI. What is it that you do and what's your passion about?
Well, I'm drawn to the message of you know, being able to share that life can be better and that there's hope. Through the work that I've been fortunate enough to do in this area, there's always been a tone of advocacy involved in empowering and educating the Hispanic community through whatever advertisers, to be honest, or affiliations or partnerships we had going on at the time. When I became a parent and when I got an opportunity to be involved with NAMI, and more than that, when I saw my personal story in the midst of it, it took on a whole new level. And I realized, wow, this, you know, I won't say can be transformative, but it can definitely shine a light in area of families' lives that I guess maybe wasn't able to get through before. You know, so if we can, or if I can serve as an example that you know, you can come out of that darkness, that you can you know, see a light at the end of the tunnel, that there's hope, and that it's okay to ask for help to find that hope. That's an important message, because I remember for me personally,
it's huge.
Not only seeking therapy for my you know, whenever we saw, you know, talk to therapists on behalf of our children, but when I attended or when I saw a therapist myself, or, you know, things that I was dealing with me. First time I stepped in the door, you know, you had to pry me off the wall in order to be able to do it. I was so scared, and there was such a shame. There was such a cloak of fear, you know, and it all stems from a message that I received early on in growing up, where I was told that I needed to look after myself. And in turning to someone else for help, it was going totally against what I was told to do when I was a kid. You know, I wasn't able to look up after me. I was asking someone else to help me do it, or someone else to do it for me, I was thinking. So I had to change my thinking that way, because I realized now that asking for help is one of the most courageous things that you can do. You
Absolutely.
There's an unequal bravery to that. So,
yeah, and I know, you know, a lot of times when we face these, you know, cultural issues, we'll give an analogy to the client that they can take home. You know, you don't know about brain surgery, but if you had to perform brain surgery, wouldn't you ask for help?
Of course.
Mom is going to say, of course you would. You'd never do brain, you know, and mom, if you need to cook a gourmet dinner and you've never cooked a gourmet dinner, aren't you going to get some help somewhere to do it? Doesn't mean anything's wrong with me. It means I need information and guidance. That's all it is. Exactly. And, you know, sometimes medication is definitely something that there's a stigma about too. That's a whole nother level. And that can be addressed in the counseling session as well, and try to remove that stigma. We have some questions. I know Shane asked a question, and I'm not sure if that's the one that's up here. Shane asked a question: what can officers say to better, and I don't have access to the chat, I'm sorry, but I saw it pop up.
It says, how can officers better serve and be understanding towards minority concerns, and how to begin the conversations in mental health?
I think that's a huge question. Just breaking it down, we're talking about, you know, we could be talking about officers within their own ranks with mental health issues, right? Talking with one another. I think that's a huge thing. And that's stigmatized often also. The officers need to have it all together, right? But a lot of times they're dealing with a lot, and they oftentimes have, in the law enforcement setting, how can they better serve? And I think it starts with serving one another.
Right. Culturally, just understanding who we are culturally, and we're different, but we're all the same, and we're all in the same areas. Sergeant Vandergrift does a great job of that, but I've seen more and more improvement, especially with our crisis intervention teams in Benton County as well as Brazoria County. And it's just understanding culturally, having these cultural events where you have Black, white, Asian, LGBTQ, everyone involved and coming together. Once we start understanding where we all are and not a crisis setting, I think we can better understand when that type of setting happens, what we need to do. So the trainings that Sergeant Vandergriff has are awesome for the police officers. And I think that if we continue that, but also add a piece of the cultural piece to that training as well would be perfect.
I agree, because what Shane does admirably is meet the community where the community is at,
Right.
And in doing so, doesn't really approach the community by coming off as being superior to them, but being one of them. And that's important for them to feel that, when they start cloning people, we need to get Shane first in line and like him out there, or we need to clone his program, and have him teach others. Because Shane's an awesome individual, and they do a tremendous work. But it's taking what he has started and putting more of that in the community.
Absolutely. And going to that again, I think what you're saying, Jonathan, in particular, is that trust is built not through just having a certain kind of interaction. We need to have a social interaction. And that trust can be built through repetition of that social positive interaction.
Exactly, because also it takes time. It
does take time.
Yeah.
And that's to acknowledge also that, it's been shown with the demonstrations that have gone on, with the issues that went on last year in particular, that there is such thing as a societal PTSD. And a person can have PTSD because they identify with someone else who's had a negative experience. That normally that experience only would qualify in the DSM as PTSD, but we're understanding that those effects can spread. Absolutely, they can spread within that cultural or religious or ethnic group, and understanding that is important. And that message is getting out, and so there's a lot less of the minimizing PTSD. We understand there's a lot of it we have not, I don't want to say accepted, but it's not in the books yet that we're seeing. And even with the COVID, there's been a lot of PTSD just from coming through that experience.
And I would say something that may seem small to an officer, to ask somebody, what pronouns do you use? I know somebody mentioned, what name do you use? Things that may seem small, but are really huge signs of respect to the person you're working with, right?
Absolutely.
It shows that you care. And I think relating, as the gentleman said, on a human level, we are all dealing with it, right? This is not exclusive to my community by any means.
Yeah. And that's really, I think, going back to everything that we've said, that when mental health workers, in whatever realm they are, they have to convey that they see the client, that the client is seen and accepted for who they are and where they are. And you're safe here, and I'm here to help you. I'm not here to judge or hurt or question. There's a lot of things people are afraid of. They're afraid of that judgment. They're afraid of their reactions being questioned, right, or invalidated. Right. And so that can be in a hospital setting, that can be in a police encounter, that can be in a mental health appointment, or even in a doctor's appointment. So asking their name, what do you want to be called? And if there's a question, what's your pronoun? Ask them that. Where are they from? Tell me about life. All of those things make the person feel seen. And that's really what our goal is. We're human, and sometimes we make mistakes, but in general, that is our goal, right? Right. And if we're off, I'm going to apologize for the profession if we're off that day. It
But-
happens. Sometimes we're just a little off. We're tired. We get tired too. But we
for
try to
me-
be mindful anyway.
But for me personally, I don't see that as a bad thing. I mean, mistakes only mean you're human, you know?
Right. Right.
Yeah.
And we encourage our people to admit it completely, you know.
Right,
And if it's a
right,
not
right.
good day for a session, please excuse me. It's not a
Right.
good day for a session. They tell the
Right.
client right up front. Yeah, so that's great. We are just about at the end. We've got Shane's going to share some resources, and I know it's not a full list, but it's a few things that you guys can access. And actually, before we did that, I had a question for Jonathan and
Yes.
for Shane, but I don't know if Shane can get on to answer that. As part of the awareness, a lot of people say, I don't know who to call. My kid's having a breakdown. I don't know who to call. I don't know what will happen when I call.
Yes.
And so just spending a minute or two talking about what happens. Can a person call a psych hospital like West Oak Spring? Is it West Park Springs?
West Park Springs.
There
West
we
Park
go.
Springs. Yes.
West Park Springs and say, my kid needs to come in. What happens if they call the hospital directly?
Well, what we do is number one, we're going to make sure mom and or patient, depending on who's calling, our dad relative, is safe. We want to make sure there's a safe atmosphere and milieu at that particular moment. We are also able to get our crisis intervention teams involved. So Sergeant Vandegrift is a phone call away from me to say, Sergeant Vandegrift, we have a crisis in Brazoria County at this address. Can you go help and get that person to us? If that person is safe and able to do a phone assessment with us, we'll do a phone assessment at that particular time, then invite them into our hospital if they can make it in themselves and go ahead and conduct that assessment. We conduct assessments 24/7. So if whenever it happens, it's gonna, you know, when we need to do it, it's gonna happen right then. And if we need to get Sergeant Vandegrift's team involved, they're a phone call away from us. So
Okay.
now parents
All right.
can also reach out straight to the crisis intervention team too.
Okay. And so Shane, what will happen if someone, you know, their teenager, their boyfriend, someone is having a mental health issue and they're a danger to themselves or others? What happens if they call the mental health task force? I'm hoping you can unmute and tell me.
Can everybody hear me okay?
Yes.
We can hear you.
Awesome. Thank y'all so much. I appreciate y'all letting me come on with y'all today. Y'all are an amazing group of people. But to answer your question, we are the resource for Brazoria County. We are not just the people that you call when there's a major crisis going on. We are the people if you just have a question. What do we do? How do we do it? Is this a sign or symptom? That is the resource that the Brazoria County Sheriff's Office mental health team gives to the public. We don't want to be just seen as a team that comes out when there's just a crisis and we have to come over there and take somebody to a mental health hospital.
Thank you.
We want to be that team that is, hey, I have a loved one. They are exhibiting these behaviors. What are the resources? And then we go through the resources. We have the big book. It's like 4 inches thick for the
It
entire
is.
state of Texas. I have people calling me from Amarillo asking me about the resources up in Amarillo. That's the team we want to be. And that's why my question was there, is because we want to continue to learn, not just what the laws are, but how we can better serve. How can we make this more comfortable? Because it can sometimes be uncomfortable when an officer shows up and they have a gun on their hip, they have a badge on, and they tell you, you know what? You have to come with me today. I know you don't want to, but you have to come with me today. And it's very uncomfortable and scary at times. So we want to continue to learning, not just the law enforcement side of it, but the clinical side of it, so that we are doing best practices,
Mm-hmm.
people comfortable. And the easiest way to get a hold of us is always through the Brazoria County Sheriff's Office dispatch. Call and
So that's the main sheriff's number, not 911, correct?
if it's an emergency, 911. But if it is just a question they have, what is the resources in this area? What clinicians are in this area that can see me? I have this type of insurance and I need to go to this hospital. That's why I communicate so well with people like Jonathan, the reps, is so that I keep in contact and know what insurances they provide. Because you don't want to send a family to a hospital that doesn't accept their insurance, because then it's even more costly and you're putting a burden down on that family.
Right. Well, that's really good to know that you guys do that. That's great to know that. Thank you so much, Sergeant. And so I think having the list of resources up on the screen would be great at this point. One thing I was going to mention that a lot of people have told me their greatest fear when the police come is they don't know what's going to happen. They don't know where they're going, how long they'll be there. They don't know if they're just going to the police station or are they going to take them to a hospital. But explaining as much as you can, as long as they're remaining calm, of course, I know that's an issue, is always a good thing to do, I think. So here's a page with support resources for LGBTQ individuals and families. These are some great things that I believe Brooke put together for us, as well as the Good Therapy website. I think that's a great thing. We've got the Trevor Project. Okay, there we go. And then, of course, West Park Springs Hospital, which is where Jonathan is from. He's in the business office there, so you might not see him if you go directly there, but you're welcome to give Jonathan a call or an email as you like. It's open 24/7. There's a phone number right there in the chat box if you want to copy that down, or you can email. Let's see, and here's some more resources. I'm not sure who provided these.
Yeah, I provided those additional resources on that page. And I want to specifically say that Psychology Works is in Brazoria County. And that's the only one there. Brightstone Psychiatry and Sega, both of those have therapists involved, and they have multiple therapists that will travel to specific areas. So that's why I wanted to include those two resources.
Okay, thank you.
Yes, ma'am.
Thank you, Jonathan. All right, and any more? There we go. So this MWise Counseling is my clinics. I've got one in Manville and one in Lake Jackson right there on Oyster Creek Drive. We have therapists from a number of ethnicities, races, religions, cultures, and languages for that matter. I don't have enough Spanish counselors. If anybody wants to send somebody my way, I'd love that. I have one Spanish counselor who doesn't take that many clients, but we could sure use having a Spanish counselor. If for some reason we don't fit your needs, Brazoria County Counseling has grants for counseling uninsured clients, and they would be happy to receive your call. And there's the website and the telephone number. And let's see, here we go. This is great. These are culture specific resources. And who provided these?
I added some of these. They are also a more in-depth list on NAMI Gulf Coast's website. And Gil, I also provided your mental health day action information in their website as well that you mentioned.
That's great. That's great. And I think those would be great also to be accessed by counselors and in their staffing meetings to have cultural awareness, refreshers, updates, talk about situations you've had in session, talk about uncomfortable situations, right? You never know what people's experiences are. And as a therapist, somebody may have had some experience with your culture or ethnicity or religion, and being with you might not be the healthiest thing for them. And it's not personal, we know that. But just to remember that this is a huge thing to pay attention to.
If I can just say real quick, in prepping for today's webinar, I was unaware that NAMI, on their main website, nami.org, they actually have a 3-part video series that they put together called Compartiendo Esperanza, which is sharing hope, and talks about the dynamic of the Hispanic families and how to approach it and how to respectfully get the conversation going. They were really powerful. It was really good.
That's great. And, you know, I really like having videos to be able to link to on my website, and especially for clients who are needing to overcome. And if they're in other languages, you know, we've had such a variety over the past year. I've been surprised myself at the variety of people that we've had come in the door or come through telehealth, both. But trying to meet those needs, I think, is everybody's goal. And having those resources, I think, would be great to, you know, provide to potential clients. So I want to thank everybody for coming today. I want to thank all my panelists. Are there any more slides?
No, just wanted to mention for those of y'all who haven't heard about NAMI Gulf Coast, kind of what we do. We provide education, resources, and support at no cost for family members and individuals living in Brazoria and Galveston counties. You're welcome to give us a call on our helpline, that phone number right there in blue. We offer 6 monthly online support groups for family members and individuals. We also have a monthly newsletter. It's packed with a bunch of information and events, as well as webinars such as these and education programs that are designed for staff, for family members, individuals, and also for students. So I encourage you to give that QR code a scan or visit our website to learn some more information.
That's great. Thank you so much. And just a reminder really quick, as you end your Zoom, it'll pop up and say, fill out this evaluation. And if you do that, then you'll receive a CE credit certificate in the mail, in your email.
Yes, you will.
Great.
And I would just like to thank everyone for coming today to this webinar. NAMI Gulf Coast feels like it's really important to reach out to the community and provide this type of education. You know, Minority Mental Health Month is a very important month for the community to know about. And so I think this has been an excellent presentation. Dia, you did a phenomenal job as always in moderating this. We so appreciate this. And thank you to our panelists for presenting today. You were excellent. So
I really appreciate getting this group together. I think you have a great panel. And I just want to tell everyone who's attending that all of us have put our information out there for you to contact us. If for some reason you missed it or you didn't see it, you can email NAMI and they will reply with our contact information. And we're eager to hear from you.
thank you also very much for attending.
Thank you for having this, Jan.
Thank
we
you.
appreciate
Thank
the
you,
hard
Ms.
work.
Jan.
Thank you for having us.
Appreciate it. Thank you.
All right. Thank you all. Y'all have a great one.
Bye.
Appreciate it. Bye, everybody. Bye, Brooke. Bye, Jonathan. Bye, Gil.
Bye-bye.
Yeah.
Bye-bye.
Thank you.
Bye-bye, Brooke. Gil.
Guys.
Oh.
Yeah.
Thanks, you guys. Really, I really appreciate it. I appreciate the
Thank you for the
honesty.
opportunity.